everybody. Welcome to Basepaws' second annual Feline Summit. I'm so excited to be participating in the dental panel, and I got a bunch of experts to share with you today. I have, of course, Dr. Kash, their genetic expert, who's going to be talking about some of their newest kits, such as the dental kit. We got Dr. Jan Bellows, our dental specialist, who's going to be answering some expert questions for you. And then we got a new face. So we got Dr. Kelly St. Denis, all the way from Canada, who is actually a feline veterinarian specialist. So she's going to be chiming in on all of her, basically her opinion on feline oral dental health. So welcome to the second annual summit, guys. I'm excited to have you on our panel today.
Thank you. Excited to be here. Thanks so much, Ellen.
Now, we know that feline dentistry is possibly the most common procedure that's done on cats in the veterinary clinic, especially when it comes to elective procedures. Do you agree that we are still not promoting it enough in cats, even though, cats tend to have a lot of dental health? Do you think we could be doing better in veterinary medicine?
I think from my personal experience, just working in clinics, that we are missing a lot because cats can be difficult to examine, and so when we miss things, we absolutely are not promoting it enough and not showing what each individual cat really needs dental care on a regular basis.
Yeah, I think that's a great question, and we all know the stat: only 50% of cats, see a veterinarian. So just out of those cats that we do see, to get someone to actually be going through a dental procedure, that's an even smaller percentage. So we know there's a lot of cats that are, walking out there with probably dental pain and not even realizing. And I'm sure we'll get to that because they're such good hiders of their pain. So I do think, we can do a really, better job as veterinarians, but also just promoting the fact that why dental care is important, because they might not tell us.
Right, and we could do a much better job of prevention right from the beginning. So plaque and tartar can be prevented so they don't get periodontal disease. And also that at least twice a year, they should go to a veterinarian to check out if the cat has tooth resorptions, which are really painful, and half of all cats have them. So it's something that needs to be checked out.
Dr. Bellows, you've been a veterinarian for quite a long time, especially being a dental specialist. When did you start seeing feline dental health really take off in veterinary medicine?
It still hasn't taken off. No, really, seriously.
Maybe I should rephrase my question. Yeah. When did veterinary medicine start paying attention to it, that this was a problem and cats really needed to be focused on, not just with their canine, counterparts here, but like when feline, dentistry in general started becoming like a thing? Because I feel like I have that ability to say I can do a little bit my medicine a little bit differently because I work at a feline only practice. But when did you start seeing the upswing in cats, like actually, hey, we really need to be doing something more about this mouth? And then you see the products on the shelves actually starting to focus on cats, etc. When did you start seeing the upswing for oral health in cats actually start?
Great question. Well, I became a veterinary dentist in 1990. And at the time, we kept on scratching our heads, where are these tooth resorptions coming from, and doing the research. And then the stomatitis cases started proliferating, and the general veterinarians couldn't figure out what to do with them other than taking out all the teeth. And then VOHC, the Veterinary Oral Health Council, started probably about 30 years ago, checking out products that help control plaque and tartar. So to answer your question, it's getting better each year, but there's so much more in cats that need to be done. And that's kind of why Basepaws is just such a cool idea, to try to figure out if there's the biome, if the bacteria and such have anything to do with anything. So this is scratching the surface of something that's going to be phenomenal.
Awesome. What about you, Dr. St. Denis? What do you feel about the evolution of feline dentistry in private practice?
I think I would echo what Dr. Bellows has had to say. I mean, I worked in my own feline only practice for 13 years, so I'm in your similar position to you, Ellen. So obviously we didn't have to worry about the canine situation, but it has been getting better. And I even know in those 13 years that I had my practice, as Dr. Bellows mentioned, we have more products that people can use through the VOHC, and we are being able to build awareness to clients about their cat's oral health. We start early with the kittenhood, trying to get them to use products, to learn how to wipe their cat's teeth to reduce plaque. But it is a long haul process, and I do find that we're still not seeing cats enough in the practice during that adulthood, that we're missing out on a lot of dental disease because they're not coming in. So a lot of times, even now, when I do see them, they have severe periodontal disease, multiple tooth resorption, and it's more stressful for the caregiver to experience that and their cat to experience that than if we did dental care on those cats every single year and didn't let the problem accumulate. So we still have a lot of work.
Interesting.
Just in
Now,
sort of timing, I
go
just
ahead.
want to add, Ellen, like dentistry especially in cats, like as a kind of recent grad, like it wasn't something that we focused on in school, and it's only recently that it's been such a kind of even added to the curriculum. So I do think it's timely that we're looking into this, because whatever we learn, we can actually apply now in the clinic as well, and preventing maybe some of these.
Yeah.
So speaking of which, so now kind of going back to, feline dentistry in the sense of like, what can we do for it? We actually had a really couple awesome questions pop up in the feed. And one of is, how often should I be brushing their teeth at home? Dr. Bellows, what do you say? And will Dr. St. Denis agree, as well as Dr. Kash?
Well, good luck brushing a cat's teeth. What doesn't work are those little rubber toothbrushes that go over your finger, because that just moves the plaque around. Regular toothbrushes can work. The pediatric toothbrushes can work. But what I find works best is a Q-tip dipped in tuna water. Tuna water doesn't do anything medically for the cat, but you rub that right at the gum line, and you do it. The specific answer to the question is ideally it's twice a day, just like us. Plaque builds up twice a day, and once a day isn't enough. Certainly once a week isn't enough, and certainly once never isn't enough. So plaque you need to find a way to help control plaque.
Yeah, and I agree 100%. And I love that Q-tip and tuna water idea. I know that I've encouraged a lot of my clients to be explorative in terms of what their cat will accept, because toothbrushes are really not very well accepted. So I've often provided clients with gauze that they can put on their finger and wipe the gum line as well. And I had even a client who bought a bunch of cotton garden gloves from the dollar store, and she would wipe the cat's mouth and then throw them in the one in the wash, and reward the cat. But it is a training process too, right? You can't just go and do that with your cat without training them.
And you only have to concentrate on the outside of the tooth.
Yes.
Upper and bottom. The inside, the tongue usually takes care of.
Do you find it difficult that actually it's more on like the client after you have done your talk to them, and you're like, this is what we need to do moving forward to have a healthier mouth? Do you find that you feel like you pop the client's balloon when you're like, we're going to send you home with some homework, and in 6 months I better see this mouth looking really good, and we don't really set up these clients for actually like proper hand-holding training, that like this, we're going to walk you through it, we're going to show you how to do it, and we expect you to actually follow through at home? Because I feel like a lot of clients, they feel like they're in over their head, and they don't like to get around their cat's face, because of course that's like, one of their very touchy areas on them. And sometimes the cats, even if they make one meow or they fidget the wrong way, clients are like, you know what, I give up. I mean, do you find that is more of an issue after sending them home, and then you have clients that are like, well, I've actually done this at home, and you're like, do I really believe you or not? Because, the tube with toothpaste I sent you home with 6 months ago, and you brought it in to me to take a look at it, it still has all this toothpaste in it. So, where do you go from here? Do you find out that we need to do better education for clients on how to follow up with home care? Or do you find that the clients and cats still need to build a better bond with each other to actually kind of like work with each other in a symbiotic relationship to actually, take care of their oral health and build a better relationship together?
Now, well, I find I have to actually hand the client the Q-tip and say, okay, I'm going to show you how to do it, and then I want you to do it. And then sometimes some of the clients give me a look like, me? I'm supposed to do this? And I say, yeah, and it's really easy because, and it's difficult to just send a client home to a toothbrush or use a Q-tip because they can't figure out how to do it, most of them. But if you show them and then watch them, it just takes a minute or two. And then if you follow up, we actually make monthly appointments for them to see how they're doing. And that's the key. Because if they come back a year later, forget it. Ain't happening. But if cat owners are very, very dedicated to their cats, and they'll do it if you show them, and they'll keep on doing it, and they'll do it right. And they'll be very proud of their accomplishments. I'm proud of them too.
They are very,
very well said.
Yeah. And I notice when my patients come in, I can tell before the client tells me that they brush their cats or wipe their cat's teeth daily, as soon as I look in the mouth, because it really does make a huge difference in the amount of tartar and plaque buildup that the cats are experiencing if the caregiver is able to do that at least once a day. It really does make a difference.
Awesome. Mm-hmm. Good. It should make a huge difference. Now, we do have some slides that we created for the panel to take a look at it. I'm going to pop them up and we're going to kind of go through them a little bit because they're going to answer some of our panel's questions here. And so we're going to go through those real quick. Let me see if I can get them to share correctly. All right. Okay. Dr. Bellows, can you go over what's included in the Comprehensive Oral Health Assessment and Treatment, which is also known as COHAT in veterinary medicine? Can you kind of go over to and let everybody know basically what's involved in their individual care plans, because it's not the same care plan for every pet?
Right. So we've changed that name to now COPAT, COPAT. Comprehensive Oral Prevention, we're putting prevention first, assessment and treatment. And this is a under anesthetic examination at least once a year, sometimes twice a year, for cats to evaluate each of the 30 teeth one by one under anesthetic. Why it has to be under anesthesia is because we take dental x-rays, because 60% of the tooth is below the gum line. That's the only way to see it, is by dental x-rays. And the only way to take dental x-rays is by using anesthesia. So anesthesia can be accomplished very safely, very little to worry about. The veterinarian first checks out the cat, makes sure the exam is okay, heart sounds good, EKG is okay, blood work's okay, places under general anesthetic, takes full mouth x-rays, then evaluates each tooth. This is the assessment part, is evaluating each tooth one by one. And in half of the cats, we'll find at least one tooth that has tooth resorption. And unfortunately, teeth that have tooth resorption are painful, and many of them have to be extracted. That's, based on where the resorption is, and it tends to be progressive, so you want to get it out of the mouth as soon as possible. So the COPAT is Comprehensive Oral Prevention, Assessment, and Treatment. And all those three steps have to be done to, kind of secure that the cat has a very healthy and pain-free life.
Now, you just spoke about the oral resorptive lesions. Why can't cats have fillings done with them? Can you explain that to the audience?
Sure. In humans, cavities occur from eating sugary food in the pit and fissures of teeth that the bacteria called strep mutans starts to eat away the enamel. And the dentist, if they respond to the pain you're having, will remove the caries part or the cavity part and then fill it with bonding material, and that's it. Unfortunately, in cat cavities, because they're not really cavities, they're called tooth resorptions, they start at the gum line, then go inside the tooth below the gum line and pop out on the outside. So they cannot be filled. And still at this time, we do not know what causes tooth resorption in cats, and we don't know of any treatment that works other than extraction.
And this is where you come in, Dr. Kash, because Basepaws now has the DNA dental kit. So can you explain to us how this is going to help progress dentistry in general in veterinary medicine?
I mean, yeah, Ellen, it's something that we are still trying to figure out, what causes tooth resorption. And like Dr. Bellows said, it's been a question that's been asked for many years. And we're hoping that, with this new technology, we can finally crack this really hard nut. I see you have some back there. So that's our brand new dental test. So essentially all it's doing is looking at the bacteria and all the other organisms that are living inside your cat's mouth and seeing, we've been able to see these patterns in healthy cats versus cats that have these common dental diseases, so periodontal disease, tooth resorption, and halitosis. And we see these patterns that are different when you have a healthy cat versus a cat with dental disease. So this is a good way, before we even see any physical signs, we're able to actually see if your cat has a risk of developing these diseases, especially tooth resorption, which is not something we can see until it's quite progressed. So it's really a great way to kind of work with your veterinarian, and we'll get into, how we can do that. But it's really kind of a first step at seeing, hey, like, do I need to be concerned? Do I need to be doing something more? Do I actually need to try and brush my cat's teeth? So all those things.
Right. Awesome. Well, I really appreciate you guys clarifying a lot of stuff for the panel and for our audience. We do have somebody that is asking questions in regards on stomatitis. While I will say this, we cannot answer questions about your pet in general. We do not have client-patient relationships, but can Dr. Bellows and Dr. St. Denis kind of go over feline stomatitis and, basically what it looks like, how it's generally treated, and kind of, is it curable at all?
Stomatitis is next to tooth resorption is one of the worst diseases a cat can get because it's caused by plaque, and we still don't know how to treat it other than taking out all the teeth. And it sounds very drastic because and the reason why it works is because if it's caused by plaque and if you take away the teeth, most of the plaque's gone. But even with that, only 60% of the cases are cured that way. The other cases, at least in our hands, we use a CO2 laser that helps to decrease the progression of the stomatitis. But it's a horrible disease. And there are some folks that are using something called interferon. There are some other products, anti-inflammatory products, prednisolone, cyclosporin, that also will help. But the only thing that we've really found up to this time that works is extractions.
Yeah, and there are so many medications that do get prescribed to try and treat this problem. I guess what I found in practice, and I don't know if this plays out in research, Dr. Bellows, is that the longer that we try medical treatment, it seems like when we do finally get to that full mouth surgical extraction, we're going to be having less of a positive response. So do you think that plays out in what we know from research, that we need to probably get on that mouth extraction fairly early on in the process?
Yeah, well, that makes sense. There is kind of an overdiagnosis of stomatitis also, where a lot of folks believe that anything inflamed in the cat's mouth is stomatitis, where some cases it's periodontitis. And if periodontitis can be cured, as long as there's no pocketing or bone loss, just by cleaning the teeth and using the Q-tips or using some other form of plaque control. But if generalized stomatitis, that's the entire mouth, canines, incisors, bright red, in some cases of juvenile, when they're really young, when the teeth are coming in like about, I don't know, it's anywhere between 6 months and a year and a half, and it's beet red, some of those cats can all of a sudden get immunity and they can cure themselves. But many of them do need, either selective extractions or multiple extractions. So the answer is yes, the sooner the better.
Right.
Do you find it happens in specific breeds versus, like, say, the domestic short hair cats? Or do you find it more,
Yes,
in like Abyssinians and Maine Coons, et cetera, or the Oriental breeds
exactly.
in general?
Those are the two, and any of the Egyptian breeds. But it can happen in any cat.
That would be a good one for Basepaws, Dr. Cash. I'm like, why do
I was
these
just saying,
cats,
let's
why are they
get
more
some
prone
notes.
to stomatitis than everybody else?
You know,
And
I
of
think
course, oh, sorry, go ahead.
would
Dr.
be, I was just going to say, we'd probably be the best group to figure that out because, we're looking at the breeds and now we're looking at their mouths. So, yeah, we'll need your guys' help.
Right? Okay. Awesome. So we're getting a whole bunch of questions coming in. Some of we've already answered. Let's go to the next slide and see what we have to share with everybody. Oh, okay. Here's a good one. Calculus, gingivitis, oral lesions, masses, and more are checked for during the visual exam at your veterinary office. And also this is done under anesthesia as well. Dr. Bellows, can you go over on what we're seeing in some of these slides? These are actually from some of our patients at Nova Cat Clinic that I kind of gathered. I'm sure you have a lot more interesting ones than we do, but can you kind of give the
Sure.
overview on what's going on in these photos?
Sure. The first slide to the left, basically all I see is calculus. And what happens is plaque builds up within 12 hours. If it's not taken away with Q-tips or toothbrushes or wipes or garden gloves, then calcium and phosphorus mineralizes on the plaque, and you have calculus, and calculus or tartar is rough, and that promotes more plaque to get on there, and then more calculus, and eventually you get periodontal disease from that. So it's something you don't want to see on your cat's teeth, especially the upper one, all the way, that last arrow on the top. That's the favorite tooth to get the calculus. The image on the right is an ulcer in the hard palate. And most commonly, ulcers on the hard palate are the same as these growths on the tongue, which most probably both of those are called eosinophilic granulomas. And they come from actually fleas, believe it or not, the flea allergy and other allergens. The one on the top can usually be treated with steroids or anti-inflammatory. The one on the bottom in the tongue has to be treated surgically.
All the more reason for cats to be on flea preventative. If you're saying that these potentially could be due to flea allergies, right?
Yeah, yep. And all the more reason to go to your veterinarian at least twice a year.
Right. And then who's to say, like, during a routine oral exam in your office, say Dr. St. Denis, you would not see most of the time, because that tongue, we actually had to pull that tongue out pretty far, and that's when I was actually intubating the cat for the dental, and that's when I was like, whoa, wait, there's a bigger problem here than what we originally had. And going back in the notes, one of our practitioners was like, I did not see that on physical a couple months ago when they came in. So all the better reasons why cats need to have full anesthesia dentistry procedures so we can catch these problems sooner rather than later, because these can get quite big.
Yeah, and they can be quite
cats.
painful for sure. And yeah, even the most cooperative cat handled in, a fear-free or cat-friendly manner can still be not willing to open their mouth and say ah like we would do, or allow the dentist to look in our mouths the way we do. So absolutely, the anesthesia is essential to finding some of these things. And, it's not shown here, but as cats get older, they're also at increased risk of potential oral tumors or cancer. And those things are sometimes under the tongue or at the back of the palate or the back of the tongue. And we will not see those until those cats are in for under anesthesia for their routine dental care. So it is very important for that anesthesia to happen.
Awesome. All right, let's see what else we have going here. All right, and then x-rays. This is the one topic that everybody tends to debate on when it comes to presenting, say, your client with an estimate for dentistry. And they're like, x-rays? I don't need x-rays every single year. X-rays are dangerous. Can you guys kind of elaborate to our audience on why dental x-rays are so important, what they tell us, and why they are necessary at every single dentistry visit when your pet is under anesthesia for this procedure?
Well, that's easy. First of all, in humans, x-rays are recommended by the ADA at least once a year. In animals, if you go for the idea that 1 year equals 7 years in animals' lives, at least that 1 year under anesthetic visit, you better get the dental x-rays to see what's going on below the gum line. And if you see especially the images on the left, the crown part is that part above the bone. And there's very little crown that's up there. Most of it's the roots, and you cannot tell what's going on with the roots without x-rays. The image on the right-hand side, the third image, is severe periodontal disease, where the bone is almost all the way down to the bottom, and tooth resorption. And there's a tooth that the back tooth, the molar on the left-hand side of the bottom, the roots are exposed. Without even a crown, the crown broke off. So that's painful for the cat. On the right-hand side, there's a tooth that has extra teeth in there. That syringe, or the metal part on the right-hand side, shows some teeth that shouldn't even be there. The cat was born with 2 extra teeth that shouldn't be there, that is going to cause crowding. So there's so much that can be told with an x-ray, and because of digitization, the x-ray exposure is 1/10 of what it used to be. So there's no excuse not to take dental x-rays. And at least in our office, we have a dental plan, and most of the offices now have wellness plans, and the dental x-rays and the teeth cleaning are included on the wellness plan. So it works out real well.
Awesome. Dr. St. Denis, we just had a question popped up in our polls on what can be done for a cat with a heart murmur. They were told that anesthesia was basically a no-no. Like, what is your feelings about this? Because we get plenty of cats that have heart disease, and we take care of them according to what our specialists tell us to do. I mean, what is your feelings about cats and heart disease and anesthesia, and what should be done and what shouldn't be?
If a cat's diagnosed with a heart murmur and that extra sound that comes up during the blood flowing through the heart, there can be a lot of reasons why we hear that, and it may not be a severe problem with that heart. There could be something what we call an innocent murmur, or something that the cat was born with that's actually not going to put them at increased risk for anesthesia. But when we find those murmurs, what we really should be doing, if the client can pursue it, is actually doing diagnostic testing to find out what the murmur is caused by, because that will tell us if the heart has some problems. And then when we understand what problems the heart has, we can actually tailor the drugs that we choose to that patient to make their anesthesia safe. And we shouldn't be avoiding dental care just because a cat has a murmur. We should be looking into why the murmur happened, what is the murmur caused by, and what can we do to pursue an anesthesia for dental care in a safe way, because there's usually options to choose that we can still go ahead and do anesthesia. So for sure, we should be looking at that. Yeah.
Dr. Bellows, would you agree that cats that do have underlying heart disease or actually have active heart disease, those are the clients that should be doing more proactive care at home?
Oh, absolutely, because you don't want the bacteria underneath the gum line to invade the valves. And clients shouldn't be afraid of placing their cats under general anesthetic as long as the cat's been checked out, because generally if they walk in, they walk out. You know, they unless they're in really tough shape. There are 5 different levels of anesthesia when they come in, and the stage 5 is the cat that is in really, really bad shape. But stage 2, 3, and 4, which show, you know, they have some disease, they generally do really, really well. And in many of the specialty practices like ours, we work with either a anesthesiologist or an anesthetic nurse. Very similar, like if a human was going to go under anesthetic, they either have an anesthesiologist there or a anesthesia PA to help monitor the anesthesia. So heart murmurs by themselves should not be an issue. Kidney disease, hyperthyroidism, these are all things that cats get, and they generally do very, very well under anesthesia.
Right. And that brings us to the second question. It's almost like a two-parter, and we're going to answer this one live so everybody can see it. The severity of elder cats versus the risks of anesthesia. Dr. Denis, you just finished senior guidelines with the AFP. What do you say about this?
So I'm not 100% sure what they mean by severity, maybe severity of dental disease with elder cats, but really when cats are aging, yes, they can have diseases that they develop and they are more potentially frail. But that isn't a reason for us to avoid using an anesthetic in an old cat. We need to properly prepare, as Dr. Bellows has described. We do our physical examination, we check their blood pressure, we check their blood work and make sure that everything is good. And if there are abnormalities, then we adjust accordingly our plan for that cat's anesthesia, and we move forward with the dental care under anesthesia. Because sometimes people will say to me, oh, my cat's 15, I don't really want to take that risk. But then if that cat has painful dental disease and it lives till it's 18 or 19, it's spending 4 years in pain. So what we really want to do is provide a safe anesthesia that's tailored to that senior cat and its needs, and make sure we still go ahead with that dental care under anesthesia.
Right.
Right. There virtually isn't any age that we won't. I mean, the oldest one I've anesthetized was 23 years old for dental care, and it did great. And we have a lot of 18, 19-year-old cats that come in every year, and they do fabulous. I mean, cats are very good under anesthesia generally.
They do. They're a lot of fun to work with. Now, Dr. Kash, this question is specifically for you because now we're talking about anesthesia, we're talking about heart disease, et cetera. Now, you guys have the dental kit out there, but I don't know if everybody knew that Basepaws with their regular DNA kit, you actually look at some of the hypertrophic cardiomyopathy factors. Can you go into that in a little bit of detail for everybody?
So, this is the dental panel, so we won't spend too much time talking about the other health problems, but it's really a great thing what you can do for your cat at an early age, especially if you don't know a lot about where they came from, which is a lot of the case in most cats, is not only are we looking at just their genetics, their breed, but we're able to look at what their genetics tell us about their health. So HCM, which is a heart disease, so hypertrophic cardiomyopathy is what it stands for, is one of the diseases that we can check for in a panel of many other diseases. So this is something we know they can be genetically predisposed to. And then if they do have to go under anesthesia, that's something that we can let the veterinarian know. Hey, like I know my cat might be at a higher risk, so that they can prepare for that as well. So I would just say, I had a question for you guys because we talked about the bacteria and heart disease. Do you ever see things like heart disease or kidney disease with cats that do have dental disease? Does it ever get better, get worse? Have you ever seen that clinically?
I've seen some murmurs disappear, and I don't know if it had anything to do with taking care of the teeth. And I've certainly seen the cats get better once we take out the bad teeth. Clinically, I mean, the clients come back like, I have a new cat, it's jumping up on things, it's starting to lick me where I wasn't licking before. It's grooming itself, especially, one of the signs of stomatitis and tooth resorption is the cat stops grooming. It's too painful for them. So we hear that type of thing.
Right.
Yeah,
and I just allude to that because we're seeing some of these relationships between, we're looking at the mouth for dental disease, but we're also seeing that maybe it's connected to kidney disease. So just
sure.
Keep an eye out for what Basepaws is coming out next because we're learning a lot.
Right. And we're getting a lot of anesthesia questions. And I will say, going back to like the heart and kidney and everything like that, going under anesthesia from a nursing perspective, it does make the anesthesia a little bit more interesting because we have to make such drastic changes depending upon, the kidney stage disease that we have happening, along with what type of underlying heart disease we have happening here, because sometimes it's like Dr. St. Denis, I'm sure you'll agree that, kidney disease and heart disease are two of the diseases that we don't want to have holding hands because one, you need to cats do need fluids. And then again, you don't want to overload the heart with too much fluids. So we're seeing, a lot of questions in regards to that and, why we can't do certain things for cats. That being said, someone did have a question on if the cat does have kidney disease, should they be seeing a dental specialist or can their regular veterinarian actually perform the procedure? How do you feel about that?
I think it would depend on the comfort level of their regular veterinarian. So there are times when that regular veterinarian may not have a complete comfort level with putting that cat under anesthesia with that particular disease. And so referral to even a referral center, even not just a dentist, but as Dr. Bellows has indicated, sometimes they'll actually have an anesthesiologist dedicated or an anesthesiology nurse dedicated to that cat's care while it's under anesthesia, while someone else does the dental care. That might be the ideal situation. And it will vary from clinic to clinic and veterinarian to veterinarian what they're comfortable with in terms of moving forward for care. So sometimes a referral center is a good place to go if that's the case.
Awesome. That probably makes everybody feel a little bit more comfortable. Dr. Bellows, do you see a lot of cats come to you specifically when they have multimodal comorbidities actually, coming for I would say a faster procedure, since this is what you do day in and day out, that you can get the procedure done in less time than say, your normal clinician who does dentistry daily?
Yes, and most of the veterinary dentists in the country, the Board Certified Veterinary Dentists, and if any of your listeners want to find one, it's AVDC, American Veterinary Dental College, avdc.org, of all the veterinary dentists in the country. Most of us are specially trained in anesthesia, but also we work with many helpers. I usually work with 2 or 3 helpers at the time, so we can get the job done faster and done well, and the cat up from anesthesia quickly. And our typical patient is one that has some what they call comorbidity problem, whether it has heart disease or kidney disease or thyroid disease, or is
more than one of those,
aged, or has multiple tooth resorptions. It's routinely not your routine dental case.
Awesome. So here's another slide that we have here. And it's something that I don't think everybody kind of really pays attention to. When you're at your vet's office, you see your veterinarian open the cat's mouth and look at it, and they're just not looking at just how much plaque and tartar on the mouth, but they're actually looking at that the bite of the animal and how what role does it play in the physiological and mechanical well-being for these cats? I think that's one of the things that people take for granted is actually how an animal utilizes its mouth.
Sure. The normal scissor bite in a normal domestic short hair, the upper incisors should just go over the lower incisors, and there should be space for all the canines. But in some breeds, especially the ones that have the pushed-in face, the Persian types of breeds, even though it's normal for a Persian, it's abnormal. It's uncomfortable for the cat because sometimes the teeth just meet the gum line in different places, and some cats have overbites even where the lower canines are puncturing holes in the upper palate. So the veterinarian is taking a very close look on where those teeth are aligning.
Right, and then would you recommend those cats that actually have physiological damage from those teeth to either have them removed or have them taken care of by the veterinary dentist?
Oh, absolutely. Sometimes they can be trimmed in half and restored. You can't just cut them in half and leave the nerve exposed, but you put medicine on top of the nerve and you put bonding on it, so the lower canines are not making holes in the lower, and sometimes they're just extracted.
Right, gotcha. Let's see, what else do we got
here? We want the cat to be as comfortable as possible.
Right, and I think that's one of the things that a lot of people don't realize is you can actually look for a veterinary dental specialist in your area. You might have to travel a little bit for it, but sometimes what you are looking for your pet, they might be the actual answer versus your normal clinician that's in your area. I know we have several dental specialists in our Northern Virginia area alone, and we refer to them all the time. We think they're fantastic to work with, especially when we have clients that want a broader options for their cats versus than what we can provide for them.
Yeah.
Right. And the veterinarian dentist works with the veterinarian.
Right.
So
Yeah.
we take care of the really tough problems, and then the veterinarian generally controls it after that. And then if there's another tough problem, they can come back.
Right. And I don't think a lot of people realize too that you guys just do more than just dentistry on the animals. You actually do a lot of like oral restoration for like if there are actual like tumors in the mouth that we can't handle in the clinic. You guys actually do all of that fine surgery as well. You guys just don't do teeth. You actually do like everything that is in regards to like the head and the mouth, and you're actually able to like do everything on like a smaller level than what we can, and that's what you're trained
Or
for.
jaw fractures also.
Right.
If a dog or a dog and cat get together to have a fight or a car accident and the jaw fractures, the veterinary dentist has the specialized equipment and training to take care of that.
Right. Not just the teeth. Speaking of teeth, we keep getting all these questions popping up in regards to toothpaste, diets. What can we use? Dr. St. Denise, what is your favorite in practice to recommend?
Well, I know that we've talked a lot about at-home care, and to me, that's got to be the primary approach with our caregivers, that we try to help them learn how to do the home care. So whether we're using the cotton tips or something else like gauze or other products, that we're trying to get that plaque removed. And then we will encourage clients to use VOHC approved, these products that have been assessed and approved for use to help with plaque and tartar. And one of my favorites probably would be the dry diets that we have available from Royal Canin and Hill's Science Diet, that are larger kibbles and help when the cat chews them, that they're bigger kibbles, they're supposed to be chewed. They do help to remove some plaque and tartar and will help with gingivitis. So some of them do have label for that and are approved by VOHC. So those are the things that I would reach for most. But again, for me,
do you recommend them usually as treats only, or as like, we are going to switch you to this diet? Or do you use them as treats for the cat?
That's really patient dependent. So if I have a young adult cat that's healthy and I don't have any specific diet needs for that cat based on health conditions, then absolutely I will use that as their main source of dry food, although we obviously recommend canned food to our patients as well. But if we're getting into aged cats where we might have to feed them a kidney diet, for example, then we'll use some of those diets, the dental diets, as treats. So they may get 8 to 10 of them a day, and they still are crunching on them and hopefully still getting some benefit.
Good. What about these oral sprays and gels that I'm seeing in the back of some of our veterinary magazines? There's this one spray that it's like guaranteeing animals like sprayed on their mouth, and 3 weeks later, their mouth is like sparkling clean. Dr. Bellows, how do you feel about those products?
Well, that is the beauty of VOHC. VOHC stands for Veterinary Oral Health Council, and it's owned by the American Veterinary Dental College, and it has an executive director and 5 volunteer veterinary dentists that evaluate certain criteria to make sure that the products actually help to decrease the accumulation of plaque and or tartar in 2 double-blinded studies by 20%. So any product can say whatever they want, but if they're VOHC, if you see the VOHC seal, very similar to on Colgate, you'll see the ADA seal. That means that at least someone looked at the research and said, yep, this is a product that's going to be safe and effective. Anything else, they could say what they want. So there are some VOHC accepted gels and sprays, but many of them are not.
Right. And what do you feel about water additives?
And for cats, and same thing with water additives. There's some VOHC water additives that are accepted. And understand that you can go on vohc.org and see the 15 approved cat products. There are about 40 accepted dog products, but there's very few accepted cat products. So it'd be worthwhile to go to vohc.org and see the cat products.
Yeah, and I think it's important to note for caregivers that there isn't one quick fix. So we all want to have that quick thing that we can just use like a water additive and not have to think about wiping our cat's teeth or brushing our cat's teeth. But more than one treatment, more than one preventive measure is going to be more successful for your cat. in preventing that periodontal disease, the tartar and the plaque. And that's key, is that we use more than one thing.
How do you feel about the dental
Very.
treats and the size of them? Because while dental treats, like you go into PetSmart, et cetera, the other big box stores, and there are so many choices for dental treats, and then you take them home, and sometimes they're quite small, and your cats swallow them whole. And it makes you wonder why they're being promoted as a dental treat, and the cat's not even crunching on them. So how do you feel about like those products when they're like, oh, my cat gets these special green treats all the time, and you're like, okay, we still need to have a dental cleaning.
Mm-hmm.
Yeah, how do you feel about those kinds of products when, when they're not doing anything for the cat, or rather not, they're probably making a really good bond between the pet and the client, but actually not doing something for the teeth in general. How do you feel about those products when clients ask about them?
Well, there's actually two types of methods, the way these treats work. One is mechanical, and mechanical treats or mechanical products like the diets or some of the diets have to get in contact with the teeth itself. But then there's the chemical ways of decreasing plaque and tartar. And for those, you don't have to come in contact with the teeth. So many of our dental diets have mechanical and chemical ways to control plaque. So it's not that important that they chew if there's a chemical effect. If there is, like the green product that you talked about, that's mechanical only, and they have to chew on it or else it's worthless.
Well, I really appreciate you breaking all this down, because some of this even new to me. I was like, well, I never looked at it that way, because you're not taught about how these products actually work.
Mm.
Sometimes it's like, this is a prescription, grade, dental treat, and this is what it does. And the way it's promoted to the client, you'd be like, okay, well, this is how it's supposed to work. And then there's a little bit more magic to it. So I really appreciate you actually like breaking it down even further for everybody to really appreciate what these products actually do. All right, let's see here, because we're starting to run out of time. We're almost there. So fact versus fiction. This is actually a fun one. So we're going to go over these real quick. How about this, Dr. St. Denise? Can cats eat dry food with no teeth?
They absolutely can. I have one living in my house who has no teeth that loves her dry food. And I think one of the things about dry food in cats is that a lot of cats tend not to either chew it at all or they swallow it whole. But the other thing that I've noticed with cats that have had all of their teeth removed is they tend to have built up a bit of a callus on their gum lines. And she still tries to chew the dry food even though she doesn't have any teeth. So they can eat dry food, but again, if necessary, it's probably good that they are having some wet food, because we know that that's beneficial for all cats in general.
Right. And then speaking of wet food, Dr. Bellows, you can elaborate on this, and then also, chime in on the dry food. So everybody says that wet food prevents tartar buildup. Is that true or false?
It is false. They felt that dry food would help to control plaque and tartar, or wet food would, but they found that both didn't do very much to control plaque and tartar. And what really doesn't control plaque and tartar are the semi-moist foods, the foods that you have to open up in a plastic container and then put in the cat's food bowl. Those are the ones that are gooey, and that controls plaque. And going back to the dry food after tooth extractions, the main question that most clients ask after we get them over the anesthesia concern is, how will my cat eat? And after everything heals, cats will prefer dry food. They just take it up with their tongue and down it goes. So they do very, very well. They don't do well with pain, but they do very well without teeth.
They sure do.
Awesome. They do. And then sometimes what people don't realize is that little mouth that actually has no teeth. There have been some cases that I've had my staff chime in saying, even though that cat doesn't have any teeth, that cat can pack quite a bite. Regardless, and that makes you wonder, like, well, what was your restraining techniques going on? Like, why did the cat even get a little bit mouthy with you? But, cats are they adapt so well to not having certain body parts, and teeth are like one of them, and they're incredible at adaptation when it comes down to that. We've already answered the fillings for tooth cavities, and What about, how do you feel about anesthesia-free dentistry, Dr. St. Denis? You haven't been on one of our panels yet to answer this question.
I think we've really discussed how important all of the things that happen at a dental under anesthesia are. So having that full exam of the teeth, the full exam of the mouth, the x-rays, and even from just that perspective, you cannot accomplish those things in an awake cat. And then the other consideration is that cats in general don't like to be handled. They don't like having their mouths handled. And even when we're doing a simple basic physical in the exam room, it's difficult to look at all of the teeth in that cat's mouth. And we've talked about that. And so moving forward with something with an awake cat is, first of all, going to be painful and distressing to the cat. And nobody wants their cat to be painful or distressed. And it's going to miss things. We're going to miss tooth resorption. We're going to miss masses and ulcers, and we're going to miss pockets and periodontal disease. And then how do you can't take teeth out when the cat's awake. So really we need to avoid anesthesia-free dentistry and go with the proper way to treat our cats so they're not stressed and they don't have pain while the procedure is going on.
Right. So, Dr. Bellows, this actually is one for you. And actually, Dr. Kash, you can chime in this one as well. Do white teeth equal a healthy mouth in cats?
Not necessarily. White teeth will indicate less plaque and probably less tartar, but it doesn't do anything. Tooth resorption, it's such a major problem in cats. I mean, half of the cats have it. Half of cats over a year old will have at least one tooth resorption, and the cats that have one tooth resorption usually have more. And it's painful and has nothing to do with plaque and tartar. So it does not indicate a healthy mouth.
Mm-hmm. And I'm kind of seeing this question come up as well. So it kind of relates to what we're talking about. So, as general practitioners, we're looking at the cat's mouth for maybe, half a minute, if that, if they let us. So when we do recommend a dental cleaning, we're looking for something to say, okay, like, how can I convince, or how can I make the justification that being under anesthesia and doing a thorough cleaning is going to be, worthwhile for this patient. So just seeing white teeth, I think we just have to remember ourselves that doesn't mean there's no disease that there could be. So regular prevention and cleaning is important. But I think, if we do see white teeth, we're less likely to think that there might be something going on. So I think that's where tests like the Basepaws test, where we're looking at things that we can't see with our eyes, we're looking at the microbes, and actually seeing what the risk is. So I think it would be very cool if we can, learn more about how to incorporate this even in practice for those cats with white teeth that, hey, maybe they do have tooth resorption on their radar.
So with the Basepaws dental kit that's currently out, at what age do you feel that a cat's mouth should start getting swabbed at to kind of look at that biome to preemptively see if this cat is going to have like a prediction of dental disease in the future?
Mm-hmm.
Does it matter what age you use it for?
It does matter in that, you can be too young to use it. As in, you're a kitten, you're still developing your oral microbiome. And what we want to know is, what is your biome as going to be for the majority of your life? So we recommend, you've been you're weaned from your mom, you've been fully vaccinated, and you're on your way to being an adult. So at least 6 months of age to start your first baseline oral biome. That's when we know, you're less likely to have any disease going on. This is probably the healthiest mouth you're going to have in your life. So establishing a baseline, I think, is wonderful if you have a kitten. And for those of us who don't, and maybe you adopt a cat that's a little bit older, just understanding what's going on is another thing that's important. Because that's when you can get those personalized recommendations. And we know there's so many products out there. There's so many different diseases, combinations. And the test is one way that we can decide, okay, what combination of products or what combination of home care and clinic care are we going to need, and just helping us plan. And then if you can, to do it, every 6
I'm always delighted to see some of the results with the dental DNA kits. We've actually had several of our clients use them, and they share the results with us. And sure enough, when they come in for their procedures, we're like, wow, look how quite accurate like a lot of these precursors definitely are. And you guys are actually working with one of our close clients in regards to one of his cases, which is quite exciting on our end. We actually had a really interesting question pop up, and it is about raw diets. Does anybody see changes in the plaque levels if their clients have pets that are on raw diets?
In dogs, yes. In cats, I haven't seen it.
I can't say that I have either.
Awesome. Well, there's an answer for you. In regards to raw diet, guys, it's not the world's best diet out there. If you are feeding a raw diet, it needs to be done correctly, but it is not the best diet for every single animal out there for sure. All right, let's go. We only got a few minutes left. So is dental disease preventable and even if reversible if detected early, Dr. Bellows?
It can be, especially periodontal disease. If there's 4 levels of periodontal disease, the first one is gingivitis. And if the teeth are professionally cleaned under anesthesia, the plaque and tartar are removed, then the gums can turn back to normal, and then they can prevent a reoccurrence. Once the disease is progressive, once it goes to early periodontal disease, moderate, severe periodontal disease, then it becomes more progressive and not reversible. So you want to jump on this as early as possible and take your cat to the veterinarian, get the plaque and tartar removed, and figure out a way to control it.
How early is too early to see a cat for its first dental cleaning?
It's never too early. From the kittens, it starts not for, you don't need under anesthesia dental cleaning from a kitten, but you start to get the cat used to the Q-tips dipped in tuna water right at the beginning, even while it has all its baby teeth. And then just keep on going from there, because we've seen cats that that do it right from the beginning, that keep their teeth their entire lives. I've been a veterinarian for 45 years now, and so I've had a number of clients that were so dedicated to their mouths, their pets' mouths, that they kept all their teeth and they didn't have any issues with them. And conversely, I've seen people that don't do it at all, and then the teeth start to have to be removed, at 5, 6, 7 years old.
I think it's important for us to note to caregivers too that tooth resorption is not something that we can predict or prevent. So, well, we're learning to predict it with things like the Basepaws kit, but if tooth resorption happens to your cat, it's not something that you did wrong or that you could have changed. So they need treatment, and we should move forward with it.
Absolutely.
Speaking of which, I'm trying to prevent or actually kind of complement veterinary dentistry. Are there any toys that you guys recommend that can help with keeping like the mouth cleaner for cats out there? Kind of like with dogs, they always have like the rubber bones or the dentistry, enzymatic infused treats, etc., that they can chew on for long term versus swallow them whole. Is there anything out there for cats that you would recommend, or is it really you just got to come in for a professional cleaning?
I don't think that we've found anything really that works with cats. Would you say, Dr. Bellows? I know cats are not as apt to chew on things as dogs, want to chew on a bone, for example, or what would you say?
Verbeck has come out with some dental chews. They just came out with a cat one that cats seem to like to spend more time with. They used to have a dental chew that you would add water to and put in a microwave, and they could chew on that for a while, and they would think it's a mouse. That was good for the mouth also. But this new dental chew is actually really nice.
That's very exciting.
So
I'll look for that.
Verbeck cat dental chew.
Very cool. Now, speaking of dental chews and stuff like that, someone actually brought up an interesting question on how much is the environment influenced and diet influence versus genetics when it comes to oral health in cats? Can you guys chime in on how you feel about environmental aspects influencing dental disease in cats?
Yeah, we've had many clients that have households, have more than 1, 2, 3, 4, 5 cats. And a lot of times their entire household get stomatitis. So the environment has to do with that. Also, tooth resorption, cats and stomatitis cats are more common in urban areas where cats are stressed, and smokers, and cats that have different types of diets. So there's a lot of things that can affect the cat from the outside. There's things that can affect the cat from the inside too, genetically.
I'll just add that, that's exactly what we're doing, by looking at what are they predisposed to, but by changing their environment, which is the only thing we can change in their mouth, using whether it's enzymatic toothpaste, toothbrushing, the mechanical action, we are essentially trying to change those factors that are causing the disease. So it's not just, it is nature versus nurture. So like nurture is where we can intervene. So that's essentially what we're trying to do, is figure out what the problem and change what's going on.
Very cool. It's always very exciting to see what Basepaws is coming up with next in regards to kind of like decoding like the entire cat of like, what can we do to make things better, and kind of like make veterinary medicine fun, not just for us that work in veterinary medicine, because like I know like sometimes it's a little bit challenging for us to kind of stay passionate about our field, but to like really kind of build like a much better bond with our clientele to kind of make taking care of their pets like, this is going to be a lot of fun. You guys are going to have a long life together, and this is our goal for you. And so if we can work with it together, maybe we can extend their lives like even a little bit more, because that's what veterinary medicine is really about, is trying to, complement and extend the life expectancy of our companion animals.
That's well said, Ellen. I love it.
Right. Let's see, we're down to like the last 9 minutes, guys. This has gone by really fast. One question that I did have pop up previously in one of our last dental forums, Dr. Bellows, is cats with supernumerary teeth, or quote unquote Gemini teeth, when they pop up. How rare is that in cats, and do they always have to have those teeth extracted if you find them on dental x-ray and they're not affecting the cat's bite? Do you really have to remove them every single time?
Right. Supernumerary teeth means that extra teeth that show up that shouldn't be there. Gemini or twinning teeth is a tooth that has multiple crowns. And really, they only have to be acted on if they are causing pain for the animal, causing inflammation due to crowding, because the plaque and tartar are building up in between the teeth. But if the cat's happy with it and it's not causing any discomfort, we just leave it.
Awesome. Does anybody have anything else they need to add to our panels today in regards to, like, you want to, dive in a little bit deeper, like on a product or a recommendation for pets? I see a lot of people keep asking, like, my veterinarian says my cat's teeth are fine at the age of 5. Do I really believe them? And it's like one of those, like, well, we haven't seen your pet. We can't really answer that question. But Dr. St. Denise, like, would you feel that, your veterinarian wouldn't recommend a procedure if they feel like it didn't need to occur, or should they be seeking like a second opinion somewhere else if they really are unsure of what's going on?
I think it's great if we can look into a cat's mouth when they're awake and see that things appear fine or look fine. But like humans, we do really need to consider having routine care for cats under anesthesia if we can. So by putting them under anesthesia and doing the x-rays and doing the full examination of those teeth one by one, checking every detail of each tooth, we're going to potentially find things that are not visible just looking in that cat's mouth. So even if the veterinarian has looked and said everything's great, you can still ask your veterinarian to schedule a procedure for your cat under anesthesia where that full evaluation or assessment is done, so that then if there's nothing to be found and we can do a nice scale and polish, just like our dentists would do with us, then we know for sure 100% things are great. But if something is found, then we know it can be dealt with and treated right then and there, and then our cat is not living in pain.
Awesome.
Right. And also, if you take a whiff of your cat's breath, halitosis, and that's one of the things that Basepaws is going to help to evaluate, is halitosis. But if you smell something and it doesn't smell like roses, then that's not normal. Cat's breath should not smell bad. And if it does, there's probably a periodontal pocket. And, it's like if you put breakfast and lunch in your pocket, in your pants, and did not remove your pants for the next 6 months, then your leg would rot off. And that's what's happening in the cat's mouth. So if it doesn't smell like roses, take your cat to the veterinarian and say, something doesn't smell right. And if you pick up the lips, pull the back lips, and you see inflammation, redness around the top of the teeth, that's and swelling, that's painful. Even though they're eating and even though they look like they're not in pain, they are in pain, because after we take care of it, all of a sudden the cat's doing things it hasn't done before because it's finally feeling better. So you need to be the advocate for your cat, because no one else is.
Speaking of roses, somebody actually brought up a good comment earlier in the feed. They want to know, can they use something else other than tuna juice?
Yes, the tuna, anything your cat likes. If there was a way to grind up catnip, that probably would work too. Tuna juice doesn't do anything, and if you're going to use tuna juice, use the tuna water, not the oil. And people want to know where you can buy tuna water from. You just take tuna fish and you just squeeze out the water and put it in the refrigerator and put the Q-tip, and it should be the long Q-tips, the ones that veterinarians have, or you can get them online, not the ones that come in that little blue box because they're too soft. But the, where do we go here? Oh, what else can you use? You can use anything your cat likes, just that they happen to like the tuna juice, and it's the friction. You have to actually rub along the gum line. And if you're rubbing along the gum line and you see blood, stop and make the appointment with the veterinarian, because that's inflammation. That's something that's not going to go away just by rubbing it away.
Awesome. Thank you. Dr. Kash, now's your time to shine. We got about 2 minutes left for you to kick off the dental care kit. Can you fill in everybody on how they can go ahead and grab one, how it works, and what it's actually going to look for?
I will do that in 30 seconds, but I just want to make sure that everyone knows what to look for if your cat is in pain. I know we kind of touched on it. That's maybe one thing, because they don't show us, not just, dropping food or pawing at their mouth, but also maybe losing weight, So just make sure that, you do book those dental appointments. But I will quickly talk about our newest test, the Basepaws Dental Test. So it's in this wonderful purple box. So you'll see it. There's a link down here that you guys can click to check out for more information. And essentially what it's doing is looking at the microbes in your cat's mouth. And all it is a simple swab. And we're able to learn about if they have a risk of developing periodontal disease, tooth resorption, and halitosis. And what that actually tells us is not only what do we need to do to prevent that, and if they already have it, booking that appointment and getting those cleanings done right away, but also can they also be at risk for some of the systemic diseases, because like we talked about, the bacteria and microbes, they do travel through the blood system and they can end up in their heart, they can end up in their liver and kidneys. So it's really a great preventative tool. And we have all of the VOHC recommendations, and we can recommend those products based on your cat's microbiome. So definitely go check it out. And if you guys have any questions after receiving your report, we have all these experts here to help guide you through those results. So we're really excited. Thank you so much, everybody, for giving us your expertise. And we're excited to be learning with you all.
Thank you for inviting us.
Well, Dr. Bellows, it's always fantastic to have you on the panels as our resident expert in the everything mouth. Dr. St. Denis, it was fantastic having a feline specialist on board with us as well to kind of give your ideas. And of course, Dr. Kash, it's always delightful to have you chime in on everything that Basepaws can provide for future health for their pets. And I hope everybody joins us at the next panel for modern pet parenting in a few minutes. So we'll see you guys then. Thank you and have a great afternoon, guys. And thanks for joining us.
Bye, everyone.
Thank you, Ellen.
Bye-bye. So, bye-bye.